everyone. In this video I want to talk about the topic of medical gaslighting and also give some education to the general population about understanding the difference between gaslighting, ignorance of your medical professional, and also currently there is a third problem zone that is uh, present in our modern lifestyles, which is the lack of ability of certain doctors to look at the patient condition based on the current environmental factors of the patient's life, all of which combined can cause a patient to have medical gaslighting related incidences happen in their life. Now, what is a medical ignorance? A medical ignorance can stem from any doctor if they are new doctors, but medical ignorance can also happen to some doctor who has been practicing for 30-40 years and of their life. Because what happens is, as we age in life, especially if a doctor was very popular and is constantly busy seeing patients, but if the doctor is so busy, he doesn't carve out his personal time to update his education related to the modern occurrences happening in his life, in the place where he is living, in the city where he or she is practicing, in general what is happening in the world. Because what usually happens with any patient's health is not simply anymore determined by just illness or a disease state manifesting in their body, that you give a medicine to the patient and they'll be getting treated immediately because of high cholesterol or diabetes or cancer or something. This paradigm that was practiced on patients and was able to provide good health care to a patient was able to succeed in patient groups when we had a cleaner earth, when our air was clean, water was clean, the environment in which we live was clean, when people led cleaner lives. At that time, when earth was much cleaner, everything that a clinical trial was testing and proving to be beneficial for a patient ended up being actually beneficial for patients, because the same clinical trial setting that is kept usually for a clinical trial, where a patient is given good food, is monitored regularly, their stats are monitored, their health status is monitored. And initially in all clinical trials, which many patients may not be aware about, but the first few stages of clinical trials are usually done on healthy patients first, to ensure that the drug is safer to use in general by the population. After the healthy stage patients have been tested using a particular drug to ensure it's safe, then the healthiest group of a disease state is tested for a particular disease. Meaning, say, there is a drug for blood pressure, and if they want to lower the blood pressure using that drug, and they are testing doing a clinical trial to test if the drug will lower the blood pressure of a population group, when they are doing the clinical trial stages of the second, third clinical trial stages, in that time, right now I'm blanking out on the details of the clinical trials because I've never conducted clinical trials, but theoretically I had studied about it, and this detail is not that important. What is important for every general patient to know is they're usually testing initially a drug on a healthy group of diseased patients. So if there are 100 patients who are going to be tested, out of those 100 patients who are entered into a clinical trial, if someone has blood pressure plus heart disease plus diabetes plus 3-4 different other disease conditions going on with them, those patients are usually tested in the later stages of clinical trials, initially just to see whether the drug is going to be effective on someone. They're going to usually take those patients who are more in the healthier middle age range or youth range, and those patients who have only one disease condition like the trial is testing for. because it is easier to analyze the data when you have only one health problem. versus if you had 3-4 different health problems. So there's a higher purpose when the clinical trials are designed like this, and they're designed in different stages to go through the different phases of the clinical trial to ensure a drug is completely or as much safe as possible for a patient population. Now, because during the clinical trials usually there are many side effects associated with medications, usually after you prescribe a patient a particular medication, in countries like US, the norm has been set that once the medication is dispensed to a patient regularly also, many other additional studies post release of the drug related studies have been conducted in US the most globally. Why? Because US was the nation which is actually the nation where a lot of drugs have been dispensed and used by the patient population for many decades. And because US government and US pharmaceutical industries were funding so many of these clinical trials, many developed countries, not just US but in countries in Europe also, the impact of the drugs have been tested a lot more than the impact of drugs have been tested in a developing country like India. In fact, in India, there is no tracking system currently. Even though the tracking systems are coming up, we have very bad tracking system about a patient's health history in India, which even in US is not perfect. Because I've worked in US healthcare, I know that the tracking systems are not perfect even in US. But compared to India, their level of tracking of a patient's health history is at least 10 times better than what it is available in India. So because of this reason and all these things about tracking a patient's health history, understanding a patient, nowadays in US or in India, when you start putting the whole data set about a patient's health history into their medical records, it takes a lot of data, it takes a lot of energy, and it also takes a lot of memory, not only for the patient to remember what is going on with their health, but the doctor also has to be caring enough to understand deeply what is going on with the patient's health. And this is where medical ignorance comes into picture. When a patient goes to a doctor and is trying to convey to the doctor that I have this disease condition that I need resolved. Now the patient doesn't know, most of the patients are not educated about a particular disease state. All the patient knows is they are sick, their symptoms are showing them that something is wrong with their body. The patient is not supposed to sit and analyze their own health data. But many a times what happens is, especially with women patients, because medical gaslighting happens more often to women than it happens to men, because firstly, when women use a lot of words, many men tend to tune out the words women are using. If I make a video of 1 hour long video, or if I'm speaking to a man for 15 minutes also, many men are there in the world who have trained themselves to tune out what a woman is saying. So if a woman speaks to a doctor for 15 minutes that I have this health issue, doctor is only if the doctor is not mindful in his home environment, if the doctor has not been mindful and respectful about listening to women, if the doctor has poor listening skills, if the doctor also has poor comprehension skills, then all of these are challenges and ignorance of the doctor. And it doesn't matter if the doctor has practiced for 30 years, 40 years, 50 years, 5 years, 1 year, 1 month. Because a doctor who has practiced 1 month can be forgiven definitely, or who has practiced only for 1-2 years can be forgiven about new information that they haven't assimilated yet. But a doctor who is practicing for 30-40 years, if he tunes out the words of a patient who has come to him with a long health history, be it a woman, be it a man, because if you're aging as a man also, you will eventually start having a lot of health problems. With women, why women are using a lot of words when they are talking is because sometimes they are ignored, because women are also very intuitive. So intuitively they are more prone to pick up when someone else is not understanding them, because of which women might over explain something. But if they are over explaining or understanding that the doctor is not picking up their health issue in the way they should pick up, these are the women who go from ignorance stages of a doctor to medical gaslighting stages with a doctor or multiple set of doctors. because if you have intuitively picked up that this doctor is not picking your health issue rightly, then the question arises, should the woman spend her money on seeing this doctor again and again if this doctor is not picking up what I am telling? If in 2-3 sessions, and women are very good at understanding when the doctor is gaslighting them, most women are, and even some men who are intuitively inclined, they also are good at picking up when someone is gaslighting them, or when someone is an ignorant doctor, or when someone is just simply a arrogant doctor, because arrogant doctors also exist in the world. Not all doctors are equal. It's like every human being. If I go to a teacher also, when we were studying in school or college or university, out of the 10-12 different teachers who teach you in a particular field of study, at a time whom you have like met, if you have had 10 biology teachers during your school life, out of those 10 biology teachers, you definitely remember some of the best teachers quite well, because those teachers explained to you exactly how biology should be explained, or explained to it in a way that was more understandable for you. Similarly, if you had 10 different teachers and your professors in your university or college days, of that also you understand which of the teachers are quality teachers, which of the teachers are understanding you, even though you are not an expert, you were a student there, right? In that college, you were a student in a particular field, but most students can still generally understand who is a good professor, who's not a good professor, who's teaching in a way that you understand. All these things most of us have intuitive knowledge about. So, and again, even if it is the most top university of the world, even there will be, out of the 10-12 teachers, at least 2-3 teachers who are not that top class. Same way it is with the doctors. So if you understand that you are with a doctor who is either not understanding your condition that well, or who is ignorant about their medical practice, or who hasn't updated about their medical practice, who will understand about the updating related stuff? Most healthcare oriented people will understand it. So even if I'm not a doctor, but I have a degree which gives me enough education about the medical field, and if I was good at the work that I was doing, I will be more able to pick up when a doctor is not able to pick up all the elements related to a patient's case, right? Similarly, someone who may not even be a doctor, may not even be healthcare related, but if they have good communication skills, good understanding skills, good comprehension skills, good intuition, even that person can pick up sometimes when the doctor is not giving them the right treatment. And many a times when people are blinded by the doctor's name, fame, or the simple fact that this person is practicing medicine means he will know everything, she will know everything, then at those times people have such blind faith on their practitioner, they will do whatever their practitioner is recommending to them. But this faith has to be a earned faith. If this particular doctor, even if they have practiced for 10-20 years, every person being human can fail sometimes, even after practicing for a long time in their field. If they hadn't updated at that time when they are failing to the things that were needed for them to understand what is relevant currently with the patient population group they are treating. And that's where medical gaslighting, medical ignorance, not understanding patients' personal life conditions that are impacting their health, all of this comes into picture when patients experience medical gaslighting. Now, I hope this makes sense. And gaslighting is this, like say you go to school and your biology teacher tells you something where you obviously already knew about it, say in 12th, because in India we had these things where in 10th standard whatever I learned in biology, in 12th standard also something very similar to what I learned in 10th only was being taught in 12th standard also. It was only very minorly upgraded because I had changed from one degree program's syllabus to another degree program. So this other degree program had a slightly less developed teaching in 12th standard. So that difference I could easily see that 10th and 12th wasn't too different in some of the subjects. Some of the subjects 12th was very different, but some of the subjects it wasn't too different. So this thing that you discern that who is a doctor who is better educated or who is a doctor. And I was just a 12th standard student, so how much education did I have to understand this? And even if I was the crappiest student in that subject, in fact the crappiest students also sometimes understand the difference between a good and a bad teacher more better. Because if I'm a crappy student, I could have communication skill related problem, listening skill related problem, or if I have communication skill and listening skill related problem, I may not understand who is a good teacher or a bad teacher. But if I am doing poorly in school because I can see that when a teacher explains it in a particular way that is matching my learning wavelength, I understand things very easily. And when they explain things in a way that doesn't match any student's wavelength, most students are failing in understanding that subject. That is how you distinguish. And the one who is suffering the most, like they really want to learn, but because the teacher is teaching it in such a way they are not able to learn it from the teacher, they will understand this teacher is not teaching in a way that that makes it clear for me to understand this subject, right? So that's why a student who really wants to learn and is suffering in the learning and is doing bad in class can discern. Sometimes those kind of students can discern who's a good teacher, bad quality teacher, right? That's why similarly when you go to a doctor, it's the same principle. Like how there are different doctors and teachers. If you have gone to a doctor, and it doesn't matter if my teacher was the teacher of 12th standard or a teacher in a high profile university, if the way they are teaching the coursework material that they are teaching isn't suitable for the students, it doesn't matter if they're working in the best university in the world, or if the teacher who's a really good teacher, if their teacher is teaching in a really poor quality school, again it doesn't matter if they are teaching in a very poor school, that school has no ranking or anything according to public rankings. Does it matter if to the student whether the teacher is teaching in their for the teacher's pride and ego, it might matter that they are working in a better quality school or a worse quality school. But for the students who are teaching learning under that teacher, to that student, if you, because every God creates this equality in the world, everyone is meant to have access to some good quality teachers. So you will have good quality teachers in the best institutes and in the worst institutes, in the highest ranking as well as the lowest ranking, right? So same way with doctors, you can find a really good doctor in a out of the corner, out of the way village of a city, and you can find a bad doctor in the most prestigious hospitals of the world as well. And is it your luck that gravitates you towards a particular doctor? No, sometimes you go to a particular doctor based on their reputation. But even if after their reputation you understand that this doctor is not matching my wavelength, or not even listening to all the symptoms that I am narrating to them, or sometimes patients also, if it is a woman patient, they're explaining everything, their whole health history that is relevant to their symptoms. And because many a times women will not even go to a doctor the day they get the symptoms, because most women are going through what have most women who are biologically having an average woman's body, they have had 3 to 5 days of severe painful period experiences monthly in their life. So at least 13 times in a year, for 13 times 3 to 5 days, these women have been bleeding and suffering the pain regularly in a month. So such women who can tolerate the period level pain, are they going to go to a doctor for a period level pain resolution, or will they go to a doctor only when that pain and suffering of their health condition is worse than the destabilization that happens to a woman's life monthly to them? And many women get destabilized during their period. Emotionally we get destabilized, mentally we can get destabilized, we can also physically, those women who have really painful periods need a few days of rest during those period times. So there are many reasons why women can get destabilized during their periods, and especially if the woman is really busy taking care of children, family, work, everything, and they are very sincere and hardworking women, their level of pain threshold that they are carrying with them, emotional pain, physical pain, everything that they carry with them is much greater, because of which when a woman has gone to a doctor, and the majority of the women are this way, very few women are the casual, easygoing, easy life leading women. Very few women are like that. Most women have led lives, and when they are going, especially when they're going to a doctor in middle age and they are busy, or they are not busy but they're financially challenged, that kind of women also might go to a doctor. So there are many reasons when women go. They need a quick resolution to their health issue, and they can't, if they are poor or financially challenged, they can't afford to go to 10 different doctors to figure out which doctor is the best doctor. If after going to the one top doctor recommended to them, that doctor is not resolving their problem, again they can't keep going to that same doctor if a top class level doctor is not giving them the right time to understand their health issue in the 15-30 minute session that the doctor gives to some patients. Some doctors give 15 to 30 minutes if you are lucky enough to live in a country like US. In India also some doctors will give you 15 to 30 minutes to talk about your health issue, but many doctors still don't understand and have the training of listening skills and understanding the depth of the problem of a woman's life. And this is where medical ignorance, medical gaslighting, as well as lack of updating about the current things impacting a patient's health are coming into play. Especially I have observed in India. In US also it comes into play, especially similar densely populated places of the world where the doctor is too busy, or the doctor is egotistical and narcissistic, or a doctor who has become too comfortable in his old age thinking that I've practiced for 20-30 years, that means I know everything. These kind of doctors exist globally. So if you've gone to some doctor like that, they will invariably, out of their ego, out of their ignorance, out of their lack of updating on the current health status related factors of a patient's life, out of their lack of respect for a patient itself, out of the lack of respect for a patient who has come at the last stages of their frustration to come and seek help from a doctor, all these patients can experience gaslighting and misdiagnosis and ignorance and lack of updating related health challenges with their doctors. And this is what I have been facing in India. I also faced this in US as well, but at a time my health status was not that critical. That's why I was able to let go of that challenge at that time, when my health status was not as critical. But right now, when my health was really critical, I had gone to cancer levels. But despite that, I had gone to cancer levels, I had gone to deep infection levels. There were many things going wrong with my body at that time. And despite all those challenges, and despite the medical reports actually indicating where some problem was cropping up in my body, the doctors I met in India, especially the allopathic doctors, were unable to understand the degree of complexity of my problem. There were very few doctors who did understand some of the challenges and some of the complexity, and they were non-traditional doctors of India who understood this. And why did they understand? Because they are also the students who wanted to learn and become a doctor, but maybe because of financial reasons, ranking reasons, the villages in which they practice, the places of education that were accessible to them based on their financial obligations, whatever the reason, they couldn't get a seat in a fancy allopathic field. But these were really sincere doctors who wanted to sincerely practice medicine. And because they wanted to sincerely practice medicine, even if they are not an allopathic doctor, even if they are a non-traditional doctor, license holding doctor, those doctors actually gave me better treatment regimen than the doctors who were practicing allopathy. And some of these doctors ignore sometimes patients' disease related symptoms, like my reports were showing high cholesterol and high liver damage and also kidney damage. And they were all initial stages of kidney damage, gray zones of kidney and liver damage. But the fact that I was having all these organ damages manifesting in my blood reports, the fact that I was having heightened other symptoms in my blood report, didn't mean that I simply had anemia. But because the report's conclusion said the patient could possibly have anemia, that's all the doctor read instead of reading deeply my reports. and despite my telling them it is not possibly anemia because I have already taken some measures for it. Then the second thing, I was having the first red flag of cancer related symptoms that was happening with me was appetite loss. I could hardly eat. I was getting dizzy. I was functionally challenged. In cancer you get functionally challenged. That's why in US many people don't understand this about cancer patients, and sometimes they will see a physically able person walking to a store and they wonder why they have a disability parking. Because in US when you're going to a grocery store or going to the mall for shopping or any such public places where you can park your cars in front of the parking lot of a shopping complex, people get these disability tags when they are physically or mentally ill. So if someone has a mental illness, you can obviously if they are really badly mentally ill, you can find out that, especially if say the mom of a patient like that is driving to the mall and they have the mentally ill patient also with them while they are shopping at the mall, you can easily see, okay, that's why they have a disability parking tag with them. Similarly, if you are physically disabled, your hand is you're handicapped or your legs are not working, whatever it is, you have a physical disability that everyone can visibly see when you are walking or taking the wheelchair to go inside the shop. Again, a person can visibly see you have a illness and disability that qualifies you for this tag. But there are cancer patients also who get so disabled with the cancer they can't move out of bed. I have physically faced this. That's why I know. I had days and days where I can't get up from the bed. It takes me if I get up also and start walking for even 15 minutes, I cannot walk for 15 minutes some days. Some days I can maximum stay outside for 1 hour, but I can't stay longer than 1 hour in any outside social settings sometimes. The kind of walks where I have had 10-20 years back, I have done treks in US where for entire 8-hour long treks I have done a couple of times. And here this person, my body that could do these 8-hour treks, and I wasn't the best physically able person to do those treks also, but I was at least moderately healthy enough to take a 8-hour hike in a moderately steep hill. The same person, I couldn't take a 15 minutes walk in a moderate hillside road in one of the hill stations I went to. Even 5-minute walking was difficult. My 5-minute grocery walk is difficult currently for me, 5 to 20 minutes. That if I go 5 minutes to do some grocery shopping at the local retail stores or the local shops, even that 5 to 15 minutes walking I can't do some days. And it's not a everyday thing, because that is how cancer hits you. The day the cancer is disabling you the worst, those days you will not be able to walk well for long hours or long minutes, not even hours, for minutes. Within 15-20 minutes I cannot stay outside and I have to come back home. And there are also days when I can stay outside for about an hour or two, but that 2-3 hours is the maximum I can stay outside, and that is on my best days. And despite telling this, narrating this to a doctor, he doesn't understand the severity of how disabled a person has become. Even though I gave him the comparison that this is the challenge I'm facing, all he could think, looking at my face, because I am a 40-year-old and healthy looking 40-year-old, because I look physically very healthy from the outside, internally something could be going wrong with me, he couldn't understand. And the reason why I had to understand it, because I was so disabled, I had to figure out what is going wrong. So I sat down, looked at my reports, studied my reports, and based on the reports, as well as one medical report that I had got from one of the doctors, where it was a medical misdiagnosis and medical error related report that was created. And in that medical error related mistake, the real health issue had come up in there. And based on that and all the symptoms correlating together, I figured out I have definitely cancer. Now the thing is, why have I not gone to a cancer specialist now? Because there are other things also going on in the background, not simply cancer with my health. And when other factors are present, like I had financial challenges, I had family who are not willing to understand the complexity of my health issues, I had friends who didn't understand the complexity of my health issues, I couldn't simply just walk to the bank to even take out money from my fixed deposit. I'm not working also, so all of these combined, and then my physical health status is so bad, I don't even have anyone to tell me where do you need to go, I will take you there. I didn't even have a single person tell that to me. So when I don't have anyone saying this, I don't have anyone supporting me when I need help, and I don't have the physical capacity to go to the bank to take out money from the bank, could I have gone and got this treatment done? I couldn't. Then the second thing that was problematic was where I was staying in those localities and communities. My symptoms of cancer were getting escalated when the local communities are putting sprays of insecticides, pesticides, fungicides, air fresheners, room fresheners, all this in the local environment, or people are doing construction and painting with all these highly toxic fumes emanating from the painting. So when construction work is going on, painting work is going on, spraying of harmful toxic chemicals are going on in that environment. Even if I go by myself to go and get a treatment from some hospital, at home I still need support. At home, and in maintaining a clean environment at home, I needed some support, and I didn't have that. So I couldn't simply go and spend money on something when at home life I will not have a support system to help me with that. So I got guided at that time to first figure out what to do, what are the things that I can eliminate from my life that will cause me. And before I realized that I have cancer, for first 2 years while I was going through the symptoms of cancer and pre-cancer stages, I had to first eliminate, and I had two cancers, one pre-cancer, one non-benign cancer, and one actual cancer. So this non-benign cancer related symptoms I tried to eliminate using preventative care strategies, and that one I had conscious knowledge about what are the factors that can, carcinogens that can impact the cancer related to this potential cancer in the future. When I eliminated the toxins related to that cancerous condition, benign cancer, because a benign cancerous growth in your body can convert into cancer in the future. So it's a potential pre-cancer stage. So for that disease, I went and did all the preventative strategies, and it helped me eliminate many of the debilitating symptoms that were getting impacted by that kind of cancer. But for the other cancer, I definitely do need treatment. But apart from treatment, I definitely need a place, a home environment, or a support system of some kind where I can go and get the right access to health and healthcare. And simply because I don't earn, I can't go and spend lakhs of money or crores of money on a disease, when after, say I got cured, go to a doctor, I have some lakhs of rupees in my bank account, I take out the money from the bank account and go and get the treatment. But after I get the treatment, what will I do if all the money is gone and no support system is there to help me after that? During the treatment itself also, cancer is very debilitating. So before cancer only I had such a debilitating problem. After getting the treatment, would it be worse or not? I'm going to reference a girl whose video showed how her cancer medicines were also giving her some side effects that her body couldn't take. Now she is also struggling through her cancer things. And like that, there are many other women who have not simply cancer going on in their body, and that's why when they get treatment also for their cancer, sometimes if they have only cancer, then also people can get side effects. If you have cancer plus other health conditions and other social problems going on in your life, then also, or environmental health conditions where carcinogens are present in your daily life, the treatment plus cancer plus environmental conditions, they can all overall impact your overall health status. That's why simply spending lakhs of money on a treatment where after getting treated, if I don't have a safe place to live, or a safe home or family environment or social environment to interact with, is there any point getting the treatment if I don't have those safety features present in my life to aid my health and quality of life after I get the treatment? That's why I haven't yet begun the treatment. And even if I do begin the treatment, there are many other challenges in my life that prevent it from being that easy. And then while I was sitting and figuring all this out, I figured another thing out that is impacting my health, and that is also the second tertiary quaternary reason why the universe stopped me from going and getting the treatment done for the cancer as well. Because I am 90% sure I have cancer. Everything in my reports point to that. It's just that the right healthcare practitioner hasn't looked at the reports and done the right scrutiny. And then, because I'm meant to survive through this, I've also done other practices that are out of the box practices, like energy healing to sustain myself. I also do preventative care to ensure that the water or food I consume, if they have any kind of poor quality materials in the food or pesticides in the food, because our foods are contaminated with pesticides, our clothes are contaminated with pesticides, our food and clothing and drinks are contaminated with harmful chemicals currently on earth. Not always, but because we live in a country like India where consistency and quality of products is a problem, and even getting the right access to quality food is a problem. This was another element which was impacting the overall progress from this cancerous condition that is going on in my body, and other health challenges that were going on simultaneously along with cancer. So people who are going through this, if there are many women's stories who have read their stories who live in developed countries, their advantages in developed countries, the level of things and steps people have to take to ensure a clean home environment or aid their clean body and clean health is a little bit easier to do in a developed country than it is in a less developed country like ours. And in our country like India, or a highly densely populated city of the world, which can be in a developed country, can be in a non-developed country, doesn't matter, if you have cancer developing in your body from your environment conditions, many of our normal environmental conditions in our life have carcinogenic elements in the normalized practices, because of which everyone who fails to recover from cancer, or who gets a remission of cancer after a few years, there are also the patients who get cancer of a different kind after 3-4 years of being treated and successfully treated with cancer 1, they get cancer 2 after a few years. All these things, those who are going through this, and then there are patients who have side effects from cancer treatments that are so harmful that sometimes the risk versus benefit is, what is better? Should I risk all my finances? Should I risk all taking therapy when I don't have the right conditions that keep me healthy? All these are factors that can lead for a patient to refuse therapy, wait on therapy, wait for the right therapy, and therapy in doctors' terms in less ignorant countries like India. Yes, less ignorant, no, more ignorant countries, because many doctors in India are ignorant about side effects of their drugs, or even if they know the side effects of their drugs, they do not understand at a realistic level how a drug impacts the patient. For them, it's like how say there is a mother and a father who give candies and chocolates to the kid because they love their kid so much. Now, or an uncle who comes to the home and daily gives chocolates to their kids. Now the mother who takes care of the kid and observes the kid regularly, the mother knows that if the kid eats more than a particular number of candies, the kid will get unhealthy, the kid will get sick, the kid will have vomiting or hyperactive, all these things. So many mothers have observed. That's why there's this term called sugar high that happens to kids when they consume a lot of candy. And the mothers who are strict about it, the mothers who are mindful about it, they try to restrict the candy consumption of their kids. Whereas there could be in the same family, the father or the grandparents or an uncle or an aunt who visits the kid and decides that out of love, let's give them the kid whatever the kid is asking. So if the mother has put a restriction that no more than 2 candies, and this uncle is encouraging the candy, they'll give 10 candies. Even though the uncle also knows candies are not good for health, mother also knows candies are not good for health, kid also knows it's not good for their health, the only one who's been sane and understands the actual impact and deeper level impact of the candy on the kid is the mindful mother. This is how some doctors are. They are like this uncle who doesn't understand the impact of a candy that a kid is eating, because medicines look like candies also for one particular reason. The colors in food coloring given in medicine is also there in candy. So some health harm from candy doesn't simply come from the sugar in the candy. Some health harm also comes from the food coloring in the candy. Most people haven't observed this or understand this deeply, but in countries like India, where mass amounts of food coloring is used, slowly that data is emerging about food coloring also being harmful to human health and toxic to human health. Anywhere where mass scale consumption of something that is harmful happens, that's where the data starts emerging first about something that is toxic. This is why even though coronavirus, many people say it started in China, doesn't mean that it started actually in China. It could have emerged globally everywhere on earth at the same time, but that particular place was doing some scientific studies or other research work, or they had mindful people working there. That's why first it was discovered there. That doesn't mean in that particular province in China where it was discovered is the only place in China that this virus was active. It could have been active in 10 other provinces of China. It's just that the people in all those other provinces were not as mindful, the doctors were not as observant, the researchers were not as observant. That's why they didn't understand that this virus was a different variant virus's impact was going on in that country. Or other countries also, simultaneously in India also, coronavirus could have been active in people's health, but Indian doctors don't do any tracking. So that's why the tracking didn't happen. Indian doctors assume that this is normal flu of the other kind, and they didn't do it. Because I will literally tell you, I had symptoms of the coronavirus in 2019 before the news of coronavirus hit Indian news media in the after March or April of 2020. I had the symptoms in 2020, not in 2019. I had the symptoms in 2020, but a few months before the news of it spread in India. So when I had the symptoms, very similar symptoms to coronavirus. At the time though, when I had the symptoms, when I didn't know about this coronavirus, that was, even though it was discovered in 2019 end time, by the time it became a worldwide news, it happened in the beginning of 2020. Another time also, and this is how news travels about any modern day health impacting incidents of any patient's life. So if there was a patient in 2019 who may not even live in China and had a symptom very similar to the patients who had the symptoms in Wuhan, does it mean that coronavirus started in China, or does it mean it just started globally for different reasons, and people in India were also having the same coronavirus infection in them? Or even if it may have started only in China, let's assume it started there and it came to India in after a few months because of travel and other things, or because the atmosphere, wind also, coronavirus is kind of like a airborne thing. So if it is a airborne thing, the wind travels, and say it took 2 months the wind from China to come to India, and after 2 months people in India also started getting it in the beginning of 2020. That could also have happened to some patients. And from China, did the wind only travel to India? No, it traveled from India to other Western countries on the other side of the globe. And when it traveled to United States, in United States they started seeing the disease emerge possibly a little bit later in 2020, which is when globally everyone awoke to it, right? So this is how disease spreads, this is how disease works, this is how any disease actually works. This is airborne, so understanding the air flow will help you understand the disease flow also. And if some scientist actually sits and does the correlation of data, I'm sure they will find the correlation to this to refute or support the claim that it is an airborne disease. It's up to you to understand whether it's airborne or not, but it is airborne in the sense, otherwise why were we wearing masks? We were wearing masks because if anyone sneezed in front of us, breathed in front of us, and they had the virus in them, the virus particles could have entered our lungs via just speaking to someone else, right? And breathing the same air as someone else. Because that was the reason why we were all wearing masks. So, a disease can emerge anywhere and inside someone's body also. Someone could have a particular disease which, even if the doctor doesn't give me a definitive guideline that I have cancer, doesn't mean that I didn't get cancer. Even if the doctor thinks I have anemia while I was actually having cancer, doesn't stop the cancer from progressing in my body, right? Because doctor is doing what? A diagnosis, or they're doing a deductive reasoning based on what is presented to them via the patient symptoms as well as the medical reports data. But if the doctor's comprehension skills, understanding skills, depth of knowledge, ignorance and lack of updating about the current factors that impact a patient's health are not up to date, they will not diagnose you correctly. I didn't go at that time to see a doctor when I had these flu-like symptoms, because I also assumed, and there are many patients like me who must have had in the 2020-2019 era during those couple of years of coronavirus pandemic, many patients might have assumed they have the normal flu that they had previously, because these are all mutated forms of some older flu virus. And because they are mutated forms of older viruses that cause flu, some of the symptoms are very similar. So if I had flu symptoms 10 years back and this year's flu symptom was very similar to my flu symptoms from 10 years back, many patients like me are going to sit and assume that this is a normal flu that I am getting and they will recover at home and that's it. But after recovery, after a few months, when I found in the news all the reports about the coronavirus's symptoms that the doctors were listing, almost like 4 months afterwards, when I read the current reports that were being updated for everyone, I realized 4 months later that some of my symptoms were correlating to coronavirus. But can I do anything? I already had the virus. I already got, if I had the coronavirus, say I didn't have the coronavirus, I had another flu virus. But it was very similar in symptoms to the coronavirus, because it could have been a mutated form similar to coronavirus. That's why the symptoms were similar. So I cannot confirm or deny whether I had coronavirus at that year when I had these symptoms. But because the symptoms were very similar, it helped me understand the trajectory better of how viruses also impact someone. There's something similar had happened to me in US also. There was a time when I was getting a flu-like symptom which was very similar to whooping cough. And I jokingly told my friends that I have whooping cough symptoms, but that seems very strange that my symptoms are similar to whooping cough. And you know what? A couple of months or years later, it came in the news that children in that city had whooping cough related cases emerging in those children. Something where people who have been vaccinated for whooping cough would have ignored, but again, because in that city there are conscientious doctors, there are conscientious researchers, and good tracking of public health data is done. That's why they were able to. Then also, I might have thought whooping cough was happening at say December of a particular year, and next year December they might have made it public that whooping cough cases are more. But from that December to next year's December, the 2 winters that had passed, In those 2 winters, doesn't mean that only these 18-20 cases that they found of whooping cough were the only kids who had whooping cough in that area. Some kids and some adults like me also had whooping cough, but when we went to the doctor assumed it's just a normal flu-like symptom possibly and just let it go. Or the patient didn't even go to the doctor because they're just coughing a lot. They took some over-the-counter cough medication and let it go. My cough was really unusual and very different from the cough I had usually when I get a cold and flu symptom. That's why I was worried enough to go and see the doctor. And when I had researched the symptoms, it matched some whooping cough symptoms at that time. But I also was in denial. So this denial works for all healthcare providers, thinking if I have got vaccinations for it, if this disease has not been prevalent in the patient population for so many years, how can patients get it? And like that also many doctors, even if they might think that this might be whooping cough, they might also ignore thinking why should this patient have whooping cough. But a year later, when enough patients had emerged and a doctor couldn't ignore anymore, these definitely look like whooping cough symptoms. That is when the right data was tracked and the information about it was released to the public, because enough data had been gathered by then. Same way with the coronavirus, same way with cancer also. So if you are having cancer developing in your body and you are feeling really sick and tired and debilitated, not able to have the energy to do normal functioning that you were able to do 10 years back, 5 years back, even 2 years back, at that time if your debilitating health status, the doctor is not able to resolve and understand what's going wrong with you, doesn't mean that you are physically fit. It simply means the doctor has not yet diagnosed what is wrong with you. And sometimes even if a doctor diagnoses what is wrong with you, they might not have completely diagnosed the list of things that are wrong with you, because anemia does happen in patients with cancer, certain kinds of cancer too, because if it is a blood impacting cancer, if it is a cancer that is doing some organ damage, in those times also you will have anemia related symptoms, because our body is an interconnected body. So it's not that the doctor didn't completely diagnose me, but it was a partial diagnosis and it didn't help in treating the major health issue that I had at that time. So I hope this video was educational, and if people have any questions about this video, please drop me a comment, because I'm trying to raise the awareness of patients about not ignoring their health symptoms, and also becoming mindful that if you have started therapy also, if that therapy is not entirely right for you and you are getting a lot of drug usage related side effects, educate yourself about the medications your doctor is giving you. If you are an educated person, you should have the educational knowledge or take the time and effort to understand what are the medication related side effects that can crop up in your health. And that side effect doesn't matter if you have been taking that medication. Say a cancer patient is told by a doctor, you will have to go through 6 months of therapy. In those 6 months of therapy, first 3 months a patient can be very well in that therapy and have very less side effect or hardly any side effect. But it is also possible in the later half of the therapy that by the time enough drug has accumulated in your body such that the side effects that you ignored or were very minor for you in the beginning few months could become very harsh side effects in the later few months, which your body may not be able to take. And like this girl, you could also have to realize the risk versus benefit, and she had luckily good doctors who were ready to sit with her to analyze the risk versus benefit of her therapy with her. But there are many people who do not have these kind of doctors, and we need to understand that these kind of doctors are needed in life to understand when a patient is health is at risk, when a patient and also these doctors are needed to educate the patient more about when their health is at more risk than benefit, what kind of conscious decision making should be made for such a patient. So I hope you understand why I made this video, and if you don't understand also, I can't do anything, but my hope is that people will raise their awareness and education on why medicine works, why medicine doesn't work, why if you go to the wrong doctor, sometimes you might also get prescribed medicines that may not entirely cure your disease or entirely account for the different factors that are impacting your health. And when a true therapy for a patient is done, a true therapy evaluates the risk versus benefit, evaluates the usefulness of a medicine prescribed to a patient versus the lack of use, and it also evaluates that and monitors the patient over time of therapy. If a patient is getting therapy for cancer for 1 year, you have to monitor the impact of the drug for 1 year. If the patient is a chronic patient of diabetes, for 8, 10, 20 years, for how many years you're taking the drugs, even if you've been taking a particular drug for 10 years, you have to still evaluate the impact of the drug on the patient. These kind of evaluations, these kind of re-examination, which is called drug therapy management, is lacking in India. Drug therapy management doesn't happen, medication therapy management doesn't happen, drug-drug interaction, drug-food interaction, and right now drug-environment interactions are also not fully understood by many places on earth. But our environmental conditions are also impacting many people's health currently, because right now we have to change and improve our environment if patients have to survive through severe health crisis that is happening globally currently. And this is a severe health crisis if medical practitioners and professionals don't wake up to where they are going wrong, where their understanding of medicine is not appropriate, where their understanding and practice and execution of therapy is not appropriate for a patient. It creates a lot of health hassles for the patient. When I gave that example of the child who is given candy by the uncle, a doctor is like that candy giving uncle. The doctor can prescribe you 3 different candies. Mom knows only 1 candy should be given, or not 3 candies, or mom will ration out the candy such that in week 1 the kid takes A candy, week 2 kid takes B candy, week 3 kid takes C candy. That is how a mindful doctor works. A mindful doctor understands that sometimes a patient doesn't need 3 candies at the same time or 3 drugs at the same time. And these are the mindful doctors who work in pharmacy in US. The PharmD doctors of US do this kind of work. But that level of work and practice is kind of currently been ignored in India and Indian medical systems and Indian healthcare, and not just by the doctors but the qualified professionals who could provide the right education on these topics. Those qualified professionals are also ignored in India sometimes, because practice of medicine is not simply about the doctor who gives you candy, right? It is not the doctor who writes you a candy. It is also about the nurse who provides you therapy. Sometimes the nurse will know more deeply how a medicine is impacting the patient if the nurse is giving treatment in a hospital. A pharmacist will know about this when the pharmacist is dispensing regularly the medicine to the patient in a community setting in a country like US, where we track the patient data records and we track and communicate with the patient regularly. In India, our pharmacists don't do that. They don't even know the people who come to their stores. But in foreign countries, people, if they are mindful people, if they are working in an average place where they don't have millions of people coming, they are not super busy, a good quality pharmacist or a good quality doctor observes these things, notes these things, is mindful about these things, and which is what makes them a better quality professional. Not a doctor or a pharmacist or a nurse who treats thousands of patients but remembers nothing about their patient. That person is not doing true therapy. That person is just doing mechanical therapy for their patients based on just dispensing candy to someone. So I hope this makes sense, and it sounds very harsh, but this is the best way I could explain what's going wrong in the medical practices and other things in India, and also happens globally too. But right now I'm facing it majorly in India. Doesn't mean it doesn't happen in US. In US also this has happened to me, but as I said, my health was not as bad. I was not as much in distress. That's why the medical gaslighting, or it wasn't even gaslighting, it wasn't even ignorance. That medical professional had the right education. If I went and spoke to her about the same health issue as a pharmacist, she would have considered all the concerns I was telling her, because she did that for one of my medicines. When she gave me a medicine which had a particular side effect, after we went back and discussed about it, I told her this is the reason why I don't want to take this medication. She was ready to consider me as an equal professional, as well as consider me as a patient with equal knowledge. Because even if I had gone to that same doctor without being a pharmacist and still having this education that this medicine is giving me this side effect, can we change it, she would have changed it even for a patient who's not a medical practitioner. But she is also the kind who will listen if you are some kind of healthcare professional. She'll listen to that as well, and she will also listen to a patient as a patient who knows healthcare or doesn't know healthcare. For all kinds of patients, she will do the right treatment regimen appropriate for the patient, which is what makes a doctor a good doctor. Not the education of the patient, not the social status of the patient, or the economic status of a patient, but someone who considers all these factors sometimes in providing therapy to a patient. Because she did consider some of my social factors and understood some of the social factors that were impacting my health. So that is important. You have to take into consideration a patient's social factor, environment factor, family life, social life, professional life. Everything can sometimes rule someone's therapy as well, which these kind of mindful practices aren't available from the doctors who practice allopathy in India. Most of the doctors that I have met so far, some of the non-allopathic doctors do take these other ancillary factors into consideration when they are treating a patient and treating them according to their socioeconomic and other health impacting factors prevalent in their lives. I hope this makes sense, and again, if you have any questions, please drop me a comment. Sorry for this long video, but people have to start understanding this about their own health and start taking some agency and taking the power back in making their health better for themselves by making the right appropriate changes that are relevant to them related to their health. Because some things a doctor can do, but the major thing related to a patient's health is outside of the doctor's rule. It is based on the patient's all these other factors that I mentioned specifically for myself, but this is also common to many other women, many other low social economic status people, or people who don't have jobs, who face these similar kind of challenges in their life. So I hope this makes sense, and maybe I'll make another video to explain a little bit more on each of these topics. If there's any topic you want to know more about, please drop me a comment on that, and maybe I'll make a new video on that. Thank you so much. Have a great day.